Vicodin is a combination of the opioid hydrocodone and acetaminophen. Hydrocodone is an opioid receptor agonist. It strongly activates the mu-opioid receptor and weakly activates the delta and kappa opioid receptors. Activation of mu-opioid receptors inhibit the GABA interneurons in the periaqueductal cray, resulting in increased excitation of the descending analgesia pathway. Acetaminophen is a cyclooxygenase inhibitor. Cyclooxygenase enhances the perception of pain, so decreasing cyclooxygenase levels lessens the intensity of painful stimuli. Because Vicodin has high abuse potential, it is listed as a Schedule II drug in the U.S. by the Drug Enforcement Agency and the Food and Drug Administration. Vicodin is often prescribed as a painkiller following surgery or a traumatic injury. It is rapidly absorbed by the stomach. Analgesia is often observed within 30 minutes and lasts up to 4 to 6 hours.